Hi everyone, welcome back to the Pelvic Health Project. I'm Dr. Lloyd, a pelvic health physical therapist, and today I'm going to talk to you about vaginismus. What is it? How do I know if I have it? And what do I do about it? So vaginismus is defined as having an involuntary closure of your pelvic muscles with attempted penetration. So it doesn't just mean that sex is painful, but for women with this diagnosis, it's nearly impossible. And as I mentioned, it's because your vaginal muscles are literally closing as you are attempting to have sex or use a tampon, any type of vaginal penetration. And this makes things very difficult and painful. Many women can describe this as hitting a wall, meaning that there seems to be almost a physical barrier that they meet when trying to penetrate, as I mentioned, with intercourse or with a tampon, let's say, or even with a pelvic exam. It can be primary, which means it's always been this way. And these are typically the younger women who come to me who've never been able to use a tampon and want to be able to have sex for the first time and can't. Vaginismus can also be secondary, which means you've had a span of time where you've been able to have intercourse and pelvic exams and everything's been normal, and then sometime later you're starting to notice these symptoms. Okay, so now let's talk about treatment. If you suspect you have vaginismus, I would first talk to your doctor, and then I'd also ask for a referral to see a pelvic floor physical therapist. Would you be able to address this on your own without a pelvic PT? Perhaps. I'm sure that it's possible for you to work on it on your own. However, the guidance that you receive from a pelvic PT is truly the benefit. For instance, the first time a pelvic therapist goes to perform a pelvic exam, you will likely have some clenching or tightness of your pelvic muscles. That is so classic with vaginismus. Your pelvic PT is going to be able to guide you through that and teach you how to relax and properly open through your pelvic muscles. Sometimes a patient can get this the first time around, but oftentimes if you've had vaginismus for a while, it takes a few sessions to understand how to do that and control those muscles down there to do that. Okay, so let's talk about what treatment looks like. First, we need to learn how to relax your pelvic muscles, and that includes both active and passive pelvic floor relaxation. So your therapist is going to likely facilitate that with manual treatment, meaning she's going to help you manually stretch out those pelvic muscles. We have to learn how to actively stretch your pelvic floor muscles, and that's through stretching and something I call reverse Kegels. Stay with me. I will describe that further in a future video, but essentially it's the opposite of a Kegel. If a Kegel is meant for you to close up and tighten those muscles, a reverse Kegel will be the opposite motion, how to open and relax through your pelvic muscles. Next, we will likely get into dilator use. And so dilators are vaginal cones that are often prescribed for women with this condition, any type of vaginal tightness, and they are used to stretch the vaginal tissues to a certain length to make pelvic exams and intercourse comfortable. Dilators usually come in a set of sizes, from small to large, and once you're able to work up to the size that's comparable to a penis, you should be able to start progressing into intercourse with your partner. That is, in a nutshell, is a very compressed explanation and some treatment items for vaginismus. As I always say, please comment below, ask me any questions you can, and I'm happy to explain further or answer more in a future video. So thanks so much for joining us today, and we'll see you next time.